Everybody, welcome to our Instagram Live. We're going to be talking about deep plane facelifting, question and answers, everything you wanted to know. And I've written my list of questions. So while everybody's checking in, tune in for us, comment from where you're tuning in from, and we'll give you a couple of minutes for everybody to kind of join in. We'll start with some of the common questions and answers that we get about facelifting. So give it a couple of seconds. Are people tuning in? Okay. So, where's everybody from tonight? Is it all United States or?
We have Rachel from New Zealand. We have
New Zealand is still awake. Wow.
someone from Texas. We have Perfectly Defined from the UK.
There we go.
We have Rachel from Ireland. And then we have Paulette from New Jersey and John from Liverpool and
Liverpool,
Toronto and Texas.
there we go.
Gavney just joined.
How's it going, Gavney?
And then we have people from Colombia as well.
All right.
Oh,
So let's. I've written some questions down. Let's kind of get the show on the road slowly but surely. This is your chance to ask anything that you wanted to know about deep plane facelifting. What is it? Why is everybody talking about it? I've done it for the past 20 years out of 28 years that I've done facelifting in private practice. So what is a deep plane facelift? What's so special about it? Do you need to do it, or can you do traditional techniques? We're going to talk about all that in just a second. Um, so let's drop your questions in the comments so we can address each and every question. And I see a lot more of you are joining, so let's get started. Okay, so what is a deep plane facelift? Okay, what exactly is a deep plane facelift? And how is it? Let me just grab my pictures here. Okay. So what's a deep plane facelift? How is it different from a traditional facelift? So traditionally, facelifts were initially patients would have surgeons would make a cut. They would lift up a little bit of your skin, and they would lift that skin. Some people still do that. Then in the 70s, we found out that there's a layer of muscle, this muscle that goes from your collarbone all the way to the top of your head. And we call it the platysma here, the SMAS here, and the temporal parietal fascia and galea here. So we figured out in the 70s that if you lift or pull on that muscle, you get a little bit better results than just skin-only facelift, because the skin is elastic, it gives over time, you end up having scars and it can't hold. The aging changes, the gravity changes, the volume loss changes. So, and then recently, in the last 20 years, I would tell you, deep plane facelifting, especially in the last 10, has gotten a lot of notoriety, because between these layers, so there's the skin and a little bit of fat underneath, then there's the muscles of facial expression. In between is that layer that I'm talking about, this platysma, the sheet that covers your deeper muscles. That's called the platysma. If you elevate in between these, okay, and lift that muscle layer, but you have to release some ligaments first. There's ligaments here. We call that the orbital ligament, the temporal ligament, the zygomatical-cutaneous ligaments, just different nomenclature for the fibrous tissue that holds things down. Once you release those here, 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 then you come what we call the cervical retaining ligament, mandibular ligament, masseteric ligament, and maxillary ligaments. Once you release that, this whole sheet just lifts up, and it's so dramatic. And for any doctor that's watching this, any surgeon, we have a facelift course, facelift and rhinoplasty master course in 2 months. So if you'd like, you can attend that. But anyway, back to that. So this makes this a longer lasting lift, and it makes you look natural and refreshed and a better version of yourself. It doesn't make you look pulled or any of the stigmata that everyone who comes to our office is worried about. The first thing they ask is, am I going to look like myself? I just want to look refreshed. I don't want to look weird or different. So that's, in a long way, the definition of a deep plane facelift. So, second question, who is a good candidate for a deep plane facelift? So if you have moderate to severe jowling, and the jowl is this heaviness that comes at the middle part of your jawline. If you're losing the structure of this jawline, if your midface, which is this triangle, descends, if you have hollowness around your eyes, if you have kind of lost this jawline, if your neck, which bothers most people, you're starting to see platysmal banding, extra skin, then you're a good candidate for a facelift if you're, of course, healthy and are in good shape and you're eating well and you don't have any medical problems that would prevent you from getting a facelift. And that's, again, for people who want natural, long-lasting results. So, third question, what kind of results can I expect? Will I still look like myself? So yes, the goal is rejuvenation, not making you look weird, just like a better version of yourself. And again, that has to do, for anybody who's tuning in right now, has to do with not pulling on things, with releasing ligaments that are holding the sheet of muscle from your collarbone all the way to the top of your head. Once you release that sheet of muscle and reposition where aging happened, not pulling, in different vectors, the whole vector of pull also is key, and your surgeon should be experienced in those vectors. But if you understand the vectors of aging, how you age front and down, then you can reposition that muscle exactly where it used to be, so then you look exactly like yourself, but just a younger version. So what is the recovery process like? How much downtime is needed? So we tell patients the first week or two, you're still probably a little bruised, little swollen, sutures are coming out. So first 10 to 14 days, I don't think you're going to be really socially ready. Some people are, but most people, if you give it 10 to 14 days, and then the third week, you're starting to look really good with makeup. You can go out and do things. The fourth week, we tell people you're really event ready. And again, we have a lot of pre and post-operative routines that we use that can help you along the way. We believe in nutrition and supplements that you take before, during, and after. Of course, medicinally, we give you antibiotics and steroids, but then afterwards we use photobiomodulation with LED light, yellow light, blue light before, yellow and red light afterwards, every day. And then we also have hyperbaric oxygen chambers that you can use every day. And even now, I can tell at 10 days when I look at the incisions, even 14 days when I look at the incisions, how many hyperbaric chamber sessions you've had because of how well this is healed. So first 1 or 2 weeks, you're not socially ready. After that, you're fine. Okay, so how long do the results of a deep plane facelift last? So typically probably about 10, sometimes 15 years. And the reason they last longer than the traditional skin only or maybe a SMAS facelift is because the deeper structures and the skin are repositioned as a unit, not just pulling on the skin itself. Next question. What are the potential risks or complications? So I tell patients, as with any surgery, there's bleeding, scarring, infection. We don't get much bleeding at all. You probably lose maybe 3 or 4 tablespoons of blood the entire case. We don't use drains. And you have a wrap around your head for about a day. Infection is extremely rare, but I guess theoretically it can happen. And scarring has to do with the incisions that we make. And again, if things are not under tension because you've released all these retaining ligaments and you're not really pulling anything, and you're repositioning things, then you shouldn't have any scarring either. The nerves that run in your face, there's a facial nerve that controls the nerves movement of the facial musculature. In theory, those could be damaged or injured. But again, if you know what you're doing and you're really experienced, your surgeon is experienced, you shouldn't have any issues with that. The sensory nerves, because you make incisions wherever, usually come back within a month to 6 months. So sometimes you have a little bit of numbness in your cheek behind your ears, and then that comes back with time. Okay, so this is the $64,000 question. How much does a deep plane facelift cost, and what factors affect pricing? So I looked this up. Costs range from 20,000 to several 100,000, depending on who you go to, the geographic area, what other procedures are associated with it, the experience of your surgeon, the operating room anesthesia, and again, it's the key is what other procedures are you really bundling together with a facelift. Will there be visible scars, and how long do they take to fade? So the endoscopic facelift that we do is through a small incision here and here. You cannot see that incision. It's in between your hairs. We don't shave anything. We don't shave any hairs. We don't cut any hairs. So that one you can't see. And then the entire facelift is done here. The additional incisions that you could have is if we work on your neck here, you have a big bulge and we need to tuck things under. We make a little incision under your chin here. And if you have a lot of skin and laxity and you need skin actually taken off, when you do this, if you have a lot of skin that bunches up here, or when you do that, you have a lot of skin that bunches up here, then you need to make incisions, and those incisions are made inside your ear, behind your ear, and into your hairline. Those, I would say, take about a month before you can like really wear your hair up and not see them, sometimes even 6 weeks. My general rule is by 3 months, if you come back, and if I can so much see your incisions, we laser them for you, okay? Can I combine a deep plane facelift with other procedures like a neck lift or eyelid surgery? And this is what that's kind of our signature. We're used to doing this. We combine deep plane face and neck lift pretty much always with a deep plane brow lift. If you need your eyes done, we can do upper and lower eyelid surgery. Then other things that we do are any kind of volume, like if you need fat transfer, and sometimes you need to, what I tell patients, put a little padding under the lift. So to use a furniture example, you can not just reupholster the cushions, you need to stuff the cushions a little bit. So fat transfer, laser resurfacing for the skin. Usually patients who are in their 50s, 60s, even late 40s need some sort of skin resurfacing to get rid of the fine spots, the fine wrinkling. We also do a lot of lip lifting with the face and neck lifting because they just kind of go together, especially you have a long distance here. And of course, for me, rhinoplasty is very common among this whole total facial rejuvenation. And of course, there's other things like forehead lowering and other adjunctive things, but those are the main things that we can combine together. So the answer is yes, we can do a lot of combination procedures. So how do I choose the right surgeon for my facelift? What should I look for? So the biggest thing I tell patients is you have to go to someone who's done whatever procedure you want, especially in this case, a deep plane facelift or facial rejuvenation, several thousand times. So, for example, I've been in practice 28 years. I've done thousands and thousands of facelifts and deep plane facelifts and all sorts of nuances of these procedures. They should be board certified, of course, either in facial plastic surgery, or something that represents the specialty. And you should look at the before and after pictures, their testimonials, patients' testimonials, and even interview a couple of patients if you'd like to see what they really went through. We like to put a lot of our patients even at 5 days, 7 days, 10 days, 2 weeks, so you can see exactly what you're going to get into, because it's really easy to show somebody 3 months later and they look amazing, or 2 months later, but you want to see them as they progress through the early healing stages so you know what to expect. Once you know what to expect, then it's really easy after that. The anxiety goes way, way down. So what are some misconceptions about facelifts? So one misconception is patients come in here and they're always worried. They say, I don't want to look pulled. Like facelifts make you look pulled or unnatural. And that's wrong if you do the right thing, because to me, the difference between good and great is not just technically knowing how to do a deep plane facelift, but is in the art. In other words, you have to assess somebody's face, know what they look like before, know the vectors that you want to move the muscle in and reposition the muscle in, and what they're looking for. What is their personality? What is their culture? What is their look? So you want to be able to have the art side of you make the difference between a really good facelift and a great facelift. So remember, the goal is to reposition and rejuvenate, not just tighten skin. Facelift are only for older patients, so that's wrong too. When I started, many patients would come in their mid 50s. This was 28 years ago. Now they're in their mid 40s, so they want to do lesser procedures earlier than wait till they're really, really like noticeably older. But nonetheless, we do facelifts on late 30s, 40s, 50s, 60s, and so on. Another misconception, fillers and non-surgical treatments can replace a facelift. And as you guys know, they cannot. That's why in my practice, I mean, we've always been very busy, but the surgical procedures, especially the facelifting, has gone up tremendously. The whole filler and, oh, I can fill your face with filler, and fillers lift, which is totally wrong. Doesn't work anymore. People are tired of what we call filler fatigue, the pillow face, the puffiness. And so they've realized that you can't do energy devices and fillers and threads to replace a proper facelift. So if you have no aging, maybe you can do something in your 20s and 30s to kind of just make things a little smoother. But if you really have descent of the mid-face, descent of the jawline, of the jowls, neck laxity, brow ptosis, you really need a proper repositioning, and no non-surgical procedure is going to help that. Facelift stop aging. A facelift resets the clock, but everybody gets older 10 years from now. So, but I always tell patients, you're always ahead if you never did anything. So 10 years from now, all of us are going to be 10 years older, but you're still going to look great for your age. And then that facelifts are only for women. More men are choosing to get facelifts, especially in our practice. And they're just realizing that it's not a stigma anymore. They can look better. Most men hate their necks, especially when we wear collars and ties. And we don't like this neck to show, especially the loose skin. So more men are coming in to have their facelifts done. So that's, and one last one is that the misconception is that mini facelifts, or whatever doctors are calling or surgeons are calling mini facelifts, can replace a proper facelift. So marketing is there, a mini this or a short scar that, it doesn't replace what you need to do to get the proper results. So with that, are there any other questions? Dr. Chen is being nice enough to film on a Sunday. Any questions that you see in your comments?
Is it done under general anesthesia or sedation?
So that's a good question. Most of them are done under sedation. For me, if you end up doing the nose along with everything else, then we do general anesthesia. But for everything else, we do sedation. And again, board certified anesthesiologist assesses you and decides, even if you're not doing the nose, based on your body habits and everything, is sedation good for you or not? But most of it is sedation, which is just like when you get a colonoscopy.
We have someone asking what happens to the deep smoker lines around the lips.
Okay, the deep smoker lines around the lips, we usually call them the barcode lines because they go vertically here, and then they kind of go all the way around from the axis of where your muscles were contracting and smoking all this time. And some people even have those smoker lines without smoking. So we can laser those. Sometimes when you do a lip lift, the top part of those is gone. They don't get eliminated, but they get much better. And sometimes we even put a little bit of filler underneath there too.
Okay, Andrea is asking what's the difference between SMAS and deep plane?
Okay, so that's also a good question. We covered it sort of in the beginning, but the SMAS is a sheet of muscle that comes from your collarbone. Watch this. You see this muscle right here? It goes from your collarbone all the way up to the top of your head. The middle part, we call it the SMAS. From about here all the way down to your collarbone, we call it the platysma. Here we call it temporoparietal fascia, and here we call it galea. Nonetheless, all of it is the same sheet that wraps around your deeper muscles and nerves. So a SMAS, which was this, traditionally, first people would just put a little bit of a suture in it and kind of tighten it a little bit here. Then people would cut a strip of it out and suture the space in between to pull on your face. So that's all doing things to the SMAS. What we do in a deep plane facelift There's a mobile SMAS. This is the part that moves, and this is the part that's stuck down, okay, that doesn't move. We come in here and make an incision in that SMAS, elevate it from here all the way to the midline, to the nasolabial fold, all the way to the middle of your neck, and then take that release all the ligaments and take that entire muscle and reposition it. So there's a big difference between just a SMAS lift and a deep plane lift.
And how many times in a lifetime can a person undergo this procedure?
Okay, so I've actually done 3rd facelifts before. Someone is actually wanting us to do a 4th facelift, and I'm not talking about facelifts that don't last, that somebody did 2 years ago that you have to correct it. I'm talking about, like, so let's say they do one in their late 40s, they do another one when they're 60, and they probably do another one when they're 75, and people are living longer, so you can do at least 2. But remember, if you do a proper deep plane lift, there's not much to do. There's not much more aging that's going to happen on the second one.
So how long is the recovery after a deep plane facelift?
So again, we covered that question, but usually 10 to 14 days. Most of our patients stay in our wellness center for 10 days, 7 to 10 days, and they get hyperbaric oxygen, they get yellow and red photobiomodulation and LED light. Nutrition, IV infusions, lymphatic drainage. But for the first 10 to 14 days, I would tell you, don't schedule a board meeting. The 3rd week, you're starting to look really, really good. Maybe put some makeup on, go socialize. The 4th week, I think you're starting to get back into your routines.
And do you combine procedures, facelift, fat transfer, lip lift at the same time?
We do. We combine those procedures all the time. Very common for us is deep plane brow lift, deep plane face and neck lift. So that covers you from here to here. If you need your eyes done, we include the eyes. I would say 2/3 of the people do their nose. And if you have a long distance here, and by the time you get older, this gets flatter, your upper lip gets flatter and loses its concavity. And then you don't see as much red lip. So yes, we include the lip lift with it, fat transfer for volume restoration, and of course, don't forget laser resurfacing.
Dana was asking, should the fillers be dissolved before a facelift?
So that's another good question. I personally don't want any of the fillers dissolved because I'm a big believer that when you dissolve these fillers, yes, it makes the facelift a little less troublesome when you do it, but then it kind of melts some of your own tissues. I just like to go, and when I'm dissecting the tissues, I just wash it out with water. So you don't have to dissolve it. As a matter of fact, when you dissolve it, some of the processes doesn't allow you to know exactly how much fat you want to put back in to replenish that lost volume.
And then we have a question on, can you lift the neck without incision in the face?
You can. So you can lift the neck through a little incision here. This is called a submental incision, just right under your chin. And you can tuck everything in this way under the level of your jawline, right? If you still have a ton of skin, and again, you can just grab your skin this way or pull on it this way. If you get a lot of skin accumulation, you're probably going to have to make some incisions behind your ears and take that skin off.
How much do you charge for a deep plane facelift?
So our charges vary based on what you need. I mean, some people think they need a deep plane facelift. They might just need a facelift, might just need a neck lift, or might just need an endoscopic lift from here to here. So DM us, call us, we'll tell you exactly, but you have to send us a photo or a video and we'll tell you exactly. But most people though say, okay, what about this? What about that? What about the eyes? What about the nose? What about the laser? So the price varies on exactly what you decide that you need to do. Okay?
Yeah.
So thank you guys for tuning in. I hope this was helpful, and see you next time.